Now, as COVID-19 continues to ravage the country, patients with other killer infections such as TB feel left out, with the spotlight being on coronavirus. And as Zainab Mohammed now reports, the effects of the pandemic go deeper than just overshadowing, with statistics from the Division of National Tuberculosis, Leprosy and Lung Disease Program showing a huge decrease in TB cases last year as compared to the previous years.
Deep in the heart of deep sea slums in Parklands area, we find 37-year-old Caroline Ajuang in her house going about her daily chores. From a distance, Caroline looks healthy and fine, but Caro, as she's commonly known in the area, is a tuberculosis patient. She tells me how she moved from one hospital to another month after month before finding out what truly ailed her.
Nilikuwa naenda huko kupimwa kama hii ugonjwa kubwa sio hiyo. Ugonjwa ingine yani yoyote, arthritis sio hiyo. Yani ugonjwa yote sio hiyo. Sasa nikarudi nikatulia bado kabla niende Westland. Nikatulia kabla bado niende Westland, nikarudi nikaenda hapa kwa father. Nikapimwa, sio hiyo tumepimwa ya TB. Baadaye wakanipima hizo vitu zote, wakashindwa ni gani sasa. Nikapewa madawa. Sasa nilikuwa nakunywa tu dawa ile kitu hakuna. Na ni TB tu inanimaliza na sijui.
According to her, the diagnosis changed her life completely.
Imeniadhiri vibaya. So unaona imefanya hata mwili yangu imebadilika. Sasa juu si kuanga hivyo. Sasa mwili yangu imebadilika, hata kazi unaona sasa siendi kazi, niko tu hivyo. Niko tu hivyo venye unaniona, ninakaa tu nimalizane na hizo madawa, baadaye nikisikia vizuri ndio nitapata kibarua kidogo ndio nifanye.
Moving her from being her family's breadwinner to now a stay-at-home mom, many of her relatives, friends and neighbors stigmatizing her due to TB.
Jirani naye obvious hiyo ni lazima. Wakione mwili yako si ile vile, sasa hata si wanaweza kukuchukua kama TB. Hao wanachukua ni ugonjwa kubwa. Kuchukui kama ni TB. Juu unajua TB na hiyo ugonjwa kubwa unaona zinamalizanga mwili na change. Sasa najua hao wanajua hivyo. Hawajui kama ni TB. Sasa yule ananibagua, simbague, sasa hapo atanisaidia na nini? Mimi nitakaa na wale wenye hawanibagui, wenye wanajua venye niko.
Caro suspects she got TB from her drinking sprees.
Nilikuwa nakunywa pombe. Sasa iliingia through hiyo juu saa zingine unaweza pata mtu amewekewa na hiyo glass, na saa zingine unaweza pata ni mtu mwenye atumiangi dawa. Na hii mambo ya unajua kwa club si kuna nini? Kuna masigara, watu wanavuta masigara hivi. Sasa hapo ndio nilipatia hapo.
However, she's not alone in the fight against the silent killer. In the other side of the slums, 17-year-old Rose Kaleche understands all too well what battling TB means.
I got TB from 2019 August. That's when I discovered that I had TB.
Similar to Caro, Kaleche suffered various instances of misdiagnosis before finding out she had TB.
It took almost, let's say, 1 month before I discovered I had TB. I was in school that time, boarding school, just having normal coughs, headaches, then tiresome. Then all of a sudden, I went to the school clinic. Then I was just given antibiotics because they did not know what I had. Just getting sick each day, worse and worse and worse. So I just stayed in school I started coughing, heavy sweating during the night, just dizziness during the day. Yeah, and nobody knew, even me, I did not know.
Kaleche, who got TB while still in school, says that together with her classmate, they suspect they got TB from one of the students in school.
I got it in school. Yeah, because my desk mates had She just got sick all of a sudden. Then her parents came for her, and she was told that she could not continue with school because she had the condition.
Unlike it is for many TB patients, Kaleche suffered stigmatization, an experience she says almost drove her into depression.
For my friends in school, they were just like, don't come near us. We just don't want you near us. Yeah. All the time when I'm around them, they're just like, just stay like few meters away from us. Yeah. Not sharing things with them. It was just not acceptable to them.
1 year later, she is a changed person after undergoing the challenges of battling TB.
Experience has changed in everything, because before I got TB, I wanted to be a neurosurgeon. But now, after going through it and knowing all people around me, it has affected me in that my dream is now after I finish school, I just want to join hands with my fellow Camila and work with TB so that we can eradicate this disease from people.
However, according to Kaleche, the onset of the COVID-19 pandemic affected her treatment. Fear of going to hospital became rife.
It was 3 days before I had finished my medicine. That's where Corona was announced that it was in Kenya. I was very scared. First of all, even I was scared of my mother coming at home because she works in the health center. Then she comes at home. I was like, Mom, first of all, you have to sanitize, do everything, because everybody was afraid of this pandemic.
These sentiments resonate with medical workers at the Westlands TB Health Facility. The sub-county head of laboratory in Westlands Sub-County, Margaret Mutunga, says in her over 30 years of experience, she has never seen dire effects in TB treatment, such as the ones caused by the COVID-19 pandemic.
TB testing went down. Starting with us ourselves, all the lab techs in Kenya refused to work on spitums. Initially, we all refused. All the lab techs, because we have forums. Everybody was scared, but we had a Zoom meeting for the whole of Kenya, the heads, the sub-county heads, and we were assured. So now we started testing again.
According to her, that led to a huge decrease in the number of TB infections recorded last year.
But the other problem was, now that is one thing that made testing go down. The other one was patients disappeared. We didn't have patients because we also chased them away. When they come here, they'll come and pick COVID from here. And everybody was so scared of COVID, they thought they were going to die. Also, the patients were not coming. So our numbers really went down.
Even though COVID-19 is the new kid on the block, experts insist that the government should not ignore other killer infections such as tuberculosis.
As really overshadowed TB diagnosis, TB case finding, and still outcome of TB so much, because they are almost the same, and COVID came with a very big stigma, more than TB. So people have tended to shy off from TB treatment because of COVID-19.
Data from the Division of National Tuberculosis, Leprosy and Lung Disease Program clearly showing the decrease in number of TB cases recorded in 2020 compared to the previous years. In 2020, the country recorded a total of 72,994 TB cases, 13,510 cases less as compared to the year 2019, where the country recorded a total of 86,504 TB cases. Further, according to the government's projection for the year 2019 to the year 2023, the country was expected to record a total number of 112,800 cases, 39,806 more cases recorded in the year 2020. The data also shows a higher prevalence of TB cases in men compared to women. In the year 2019, out of the total number of cases recorded countrywide, 55,601 cases were recorded among men, with only 30,2 229 cases recorded in women. Similar trends being reflected last year, with 47,915 cases being recorded in men vis-a-vis the 25,078 cases recorded in women. Data from the Division of National Tuberculosis, Leprosy and Lung Disease Program further showing TB killed a total of 5,353 people in the year 2019 alone, a huge number compared to the COVID-19 death tally of 2,098. Jemima Ayodi, a nurse at Westlands TB Health Facility, says fear of hospitals and the similarity in TB and COVID-19 symptoms also played a huge role in scaring patients away.
Kabla COVID-19 kuanza, wagonjwa walikuwa wanakuja hospitali kupimwa, kuchunguzwa kama wako na kifua kikuu. Lakini vile COVID-19 ilikuja, utapata wengi hawataki kuja kwa clinic, kwa hospitali, kwa sababu wanaogopa wataambiwa ya kwamba wako na corona badala ya kifua kikuu.
Hodi hapa. Habari yenu? Mnaendeleaje?
Camila Mwende, a community health worker, says the economical effects of COVID-19 have further derailed TB treatment, with job loss among patients leading to poor nutrition.
Waliweza kufutwa kazi, especially hawa wa Kinjinji, kwa sababu wengi wao wanafanya kazi za mikono, sana wanafanya kwa Wahindi. Mgonjwa ule ambaye pia anapata matibabu ya TB, kama hakuli vizuri, pia kinga inazidi kuwa chini. Na sana kama sasa akunywi mandawa, pia TB inazidi kuinuka na yeye anazidi kudhoofika zaidi.
However, experts say there is a silver lining with the onset of the COVID-19 containment measures, with the wearing of masks proving protection to people interacting with TB patients. For now, the prayer of Karo, Kaleche and all other patients of TB across the country is that the government increases efforts towards TB case findings and treatment, as current data shows the possibility of a huge increase in the number of cases by the end of this year.
The government's TB eradication goal that would have seen TB become a thing of the past appears to have been dealt a huge blow by the COVID-19 pandemic. And should the government continue to ignore this deadly scourge, that goal will remain nothing but a pipe dream. Zainab Mohammed, TV47, Nairobi.